अस्सलाम वालेकुम वरहमतुल्लाहि वबरकातुहू। इय्याका नअबुदु व इय्याका नस्तईन। सेकेंडरी प्रिवेंशन को हम डिस्कस करेंगे। It is defined as actions which halts the progress of a disease at its incident stage and prevents complications. Specific interventions are early diagnosis, for example, screening tests and case finding programs, and adequate treatment. Secondary prevention attempts to arrest the disease process, restore health by seeking out unrecognized diseases and treating it before irreversible pathological changes take place and reverse communicability of infectious diseases. It thus protects others from in the community from acquiring the infections and thus provide advanced secondary preventions for the infected ones and primary preventions for their potential contacts. Secondary preventions attempts to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible pathological changes take place and reverse communicability of infectious diseases. It thus protects others from in the community from acquiring the infections and thus provides advanced secondary preventions for the infected ones and primary prevention for their potential contacts. Early diagnosis and treatment. WHO Expert Committee in 1973 defined early detections of health disorders as the detections of disturbances of homeostatic and compensatory mechanisms while biochemical, morphological, and functional changes are still reversible. The earlier the disease is diagnosed and treated, the better it is for prognosis of the case and in the prevention of the occurrence of other secondary cases. Tertiary prevention. It is used when the disease process has advanced beyond its early stages. It is defined as all the measures available to reduce or limit impairment and disability and to promote the patient's adjustment to irremediable conditions. Intervention that should be accomplished in the stage of tertiary preventions are disability limitations and rehabilitations. Disability limitations, disease, impairment, disability, handicap. Impairment is any loss or abnormalities in psychological, physiological, or anatomical structures or functions. Disability is any restrictions or lack of ability to perform an activity in the manner or within the range considered normal for the human beings. Handicapped is defined termed as a disadvantage for a given individual resulting from an impairment or disability that limits or prevents the fulfillment of a role in the community that is normal depending on age, sex, and social and cultural factors for that individual. Rehabilitations. Rehabilitations is the combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individuals to the highest possible level of functional ability. Rehabilitation. Medical rehabilitations, vocational rehabilitation, social rehabilitation, psychological rehabilitations. Strategy for preventions. Modify existing interventions program, evaluate interventions program, apply population based interventions program, identify populations at high disease risk, assess exposures, conduct research and mechanisms. Thank you very much. Allah Hafiz.